So at the beginning stages of rehab with a rotator cuff repair, especially with your larger repairs, you're going to be experiencing a lot of passive range of motion by your physical therapist. So your physical therapist has a protocol, knows which motion should be your shoulder should be moving in. So it's important that you get that time with your physical therapist, like we do at Beyond, where we start with all our patients and we stay with them for 30 or 40 minutes before we go on to the next thing or have you do any other exercises. So what I would do as a physical therapist here, I'm going to get that protocol. I'm going to be the one that's doing the passive range of motion on you. And it's important that I have enough time to be able to get through all this for you so we don't develop any kind of stiffnesses in that shoulder or any kind of capsular restrictions. So whenever you're here, you should expect the physical therapist to be taking your arms through different ranges of motion of flexion, most likely some small degrees of rotation. We would be going through some degrees of extension as well. And then if the protocol allows, we'll go into some abduction, which is going out like this. And it's not important this early on to go as far as we can go. We're really just trying to guide the healing process. So it's really important that me and Stratton have a good relationship where he can feel comfortable just communicating those pain levels to me, and I can just sit and listen to what he's experiencing so I can change or progress what we're doing. If he's feeling pretty good and the protocol allows, we can go through different motions, maybe push a little bit further. And that's what you can expect here at Beyond is that one-on-one time to really make sure we are getting the most out of that passive range of motion early on. So if you have any other questions about that, please feel free to just give us a call. Once again, we're here in Franklin as well as Spring Hill. Thank you guys.